Why there was a need for the industry working group. I think 2 years ago, we were faced in the registry with a few problems, really. I think it's true to say that the uptake was a bit slower than we originally thought it might be because clinicians are busy, because it was new, because clinicians are quite conservative, all sorts of reasons. I think there was some blocks in understanding. Not everybody knew what the registry involved. I think we had a very limited resource. The registry executive is quite a slim team clinically, and most of us have got day jobs, and it was quite difficult to undertake the extra workload. So these are some of the reasons why I think the working group was much needed. I think actually in considering whether the IWG has fulfilled its goals, well, if you define those as, first of all, identifying some of the blocks with a view to removing them, that's been really useful because of the participation in the road shows and because of the regional awareness of what's going on in different centres. That's really helped us actually understand some of the blocks, really. And then a second big objective of increasing participation. The figures show massive changes, really, as a result of some of the effects of the working group.
I'm really pleased with how the industry working group has achieved its goals in the first year.
I think the industry working group has achieved a lot in the short space of time, really. It's been good and interesting getting it up and running, and I think we have some tangible outputs already. We've brought together a very solid industry prospectus that gives a good overview as to what the kind of information that we feel the wider industry will be interested in about the registry. In concrete terms, for IBD teams, there's been very beneficial support for data entry at a local level, which is a really important factor in convincing and supporting teams to get used to entering data on a regular basis into the registry, which ultimately fulfills its overall objectives into the future.
Another example of something that's come out of the industry working group is the field support team programme. And this is a really great example of competing companies collaborating for the good of the registry and ultimately for the good of patients. A variety of competing companies have donated the time of some of their MSLs and other field-based support staff. And the idea is that if a hospital or trust clinician or nurse has a question, an issue, something that can be resolved locally, then we have trained this sort of virtual team to go into the hospital, into the trust and see the clinician and talk to them about what is it we can do, how can we move this project forward, how can we take away the barriers that are preventing you from succeeding with the registry locally.